Hello, and welcome to another live broadcast with MedStar Health. My name is Mishan Bowman, and today I'm joined by Dr. Mrinalini Krishnan, Advanced Heart Failure Cardiologist at MedStar Union Memorial Hospital. Our discussion today will focus on heart failure and the unique challenges that come with it, especially during a pandemic. As the number of COVID-19 cases continues to climb, it's important to understand the link between COVID-19 and heart failure. So if you'd like to learn more, stick around, share this broadcast with your friends, and ask us your questions in the comments below. We're going to take some time to answer those as well. So Dr. Krishnan, thank you and welcome. Thanks for joining us today. Before we get started with our discussion, could you tell our viewers a little bit about yourself and the work you do here at MedStar Health?
Absolutely. So I'm Dr. Mirnalini Krishnan. I'm an advanced heart failure and transplant cardiologist at MedStar here in Baltimore. I've lived in the US for years now. I've done all my medical training here, but what you might not know, Mishan, is I actually grew up in Canada. So that's why I sound like this, and I'm pretty apologetic. I'm sorry about it. I've been a part of the MedStar team for about a year and a half now. That includes my year of heart failure training at MedStar Washington Hospital Center down in DC. And I'm really passionate about education, both for my own patients and just for everybody out there. So I'm really excited to be here today, talk about heart failure, talk about COVID-19 and the whole pandemic, and just teach everybody that's around a little bit more about it. So thank you so much for having me here, and glad to be a part of it.
Awesome, thank you. So first of all, what is heart failure and what are the different stages?
Yeah, so heart failure is a medical condition that unfortunately it affects over 6 million adults across the country in America. And it's actually the leading cause of hospitalizations for patients in America. So what it is exactly is a condition that affects the heart muscle. So it can result in one of two things. Either the heart is too weak to squeeze the blood out with each heartbeat, or it's too stiff to relax to fill up with blood for the next heartbeat. So either of those result in the blood from the heart not being able to get pushed out to the whole body, or the heart failing, though we don't really like the name, obviously. So heart failure, it's something that it's, you just kind of have to manage what's going on with the heart itself with medications, in order to either help the heart get stronger and help people live longer. So it can be caused by a number of things, including high blood pressure, blockages in arteries around the heart, known as coronary disease, which is actually the most common cause of it. It can also be caused by alcohol abuse. It can also be caused by several systemic conditions, including sarcoidosis or amyloidosis. And it can even be caused by viral infections, such as COVID-19 or the flu. In terms of the stages of heart failure, the American College of Cardiology and the American Heart Association have both come up with terminology from stages A through D, which is referring to patients that start with risk factors, or people that are at risk for developing heart failure. So people with high blood pressure, diabetes, they would be considered stage A. Once we start to see that patients are developing the heart muscle actually not working appropriately, like we just talked about, then they're considered stage B. That's typically when we start to intervene with the medicines that we have. And if they progress to a point that they start having symptoms from this, then it's called stage C. And unfortunately, the way that this medical condition works is it's chronic and it's progressive. So if somebody gets to the point where the medications or any interventions that we have done have not cut it, and their heart continues to fail, then they get to a point where we call them stage D, where we start considering them for things as serious as heart pumps like LVADs, or even heart transplantation.
Okay. We don't want to get to that stage, not at all. So thank you for going through all those stages, Dr. Krishnan. So next question, do heart failure patients have a higher likelihood of contracting COVID-19? I think you mentioned how COVID-19 and other similar viral conditions can lead to heart failure, but what about people who already have heart failure?
Yes. So the short answer is yes. Anybody with any cardiac condition, any condition affecting their heart, whether it's heart failure, whether it's heart blockages like coronary disease we mentioned, whether it's high blood pressure, any of those patients are at higher risk for contracting COVID-19.
Okay, thank you. And do heart failure patients have a higher risk of complications if they contract COVID? And if so, why?
Unfortunately, this is also a yes. So if you think about it, your heart is already not working as well as it should. So your heart and your body are already in a state where they're not able to handle what's going on. So the added insult of something like a viral infection like COVID is going to affect your heart and your body more severely than somebody who's otherwise healthy.
Right. And how can patients with heart disease protect themselves from COVID? What precautions can they take?
So this is all the same stuff we've been saying for a year now, right? Wear your mask, don't touch your face, don't touch your eyes, your nose, your mouth. Try to stay 6 feet apart from people, avoid crowds, all the things that we know and we're probably getting sick of doing. Those are all the things we absolutely have to do. And then when the time comes where the vaccine is available to you, you should absolutely get the vaccine because that is added protection from developing the infection.
Great, thank you. For those patients with no previous heart disease or heart failure history, can COVID-19 cause heart failure? And if so, is this reversible?
So we're learning more about this virus as days go on. So, a year ago, we really knew nothing about it. It was brand new. And as over this past year, we've noticed that there are patients who have developed myocarditis, which is inflammation of the heart muscles, which can lead to the heart becoming weaker and heart failure. We don't fully understand the whole process yet. There's some different ideas about how it happens and why it happens. But unfortunately, we have seen patients that have the COVID infection develop heart failure. In terms of how we manage that and different things we do beyond the treatment that we would be doing for COVID itself, is we try to do the typical things we would do for anybody that has heart failure in the hopes that we would improve the heart pumping function back to normal. And that's something, we're learning more and more each day, but we're hopeful that we could have recovery of the heart muscle.
Okay, thank you. Are there any cardiovascular medications specifically for heart failure that could make someone more susceptible to getting COVID-19?
That is a great question. So same thing, a year ago, we knew nothing about this and we were very concerned about a specific category of medications, which are called ACE inhibitors or ARBs. So this is lisinopril or losartan. So there was a lot of controversy, even within the medical field, whether people should be continued on these medicines or if they should be stopped. What we have learned over the past year in actual studies, both looking at patients, just observational studies, as well as actually doing a study to say patients should be on these medicines or not, is that it's absolutely safe for all heart failure patients to continue taking all their medications, specifically the ACE inhibitors and the ARBs. It makes no difference in terms of contracting COVID or having a worse version of the COVID infection.
Okay, thank you for clarifying that.
Mm-hmm.
And thank you to our viewers. At this time, I just want to take a pause and welcome anyone who may have just joined. We are live today discussing heart failure and the unique challenges that come with that, especially during a pandemic. I'm here with Dr. Mrinalini Krishnan, advanced heart failure cardiologist at MedStar Union Memorial Hospital. We have more to talk about, so keep watching. Give us a like to let us know that you're here and ask us your questions in the comments below. We're going to take some time to answer those as well. All right, so back to some of our other questions that we have. Are there risks to getting the COVID-19 vaccine for those with heart failure? And do you recommend heart failure patients get the COVID vaccine?
So I think this is an extremely important question. And I think this is something that needs to be reiterated and told to everybody, you, your friends, your family, everybody. This vaccine is very different from any other vaccine that we've developed as a medical community. So this is an mRNA vaccine, which means there is literally no piece of virus within the vaccine that they're putting into your body. So that being said, the risk when people hear about the flu vaccine and sometimes they got the flu after, that does not exist in this type of a vaccine. So what we say to all our patients and what I'm saying to everybody out there is this is a safe vaccine. It has been studied and it has been effective. So this is something that everybody that it becomes available to when the time comes should be going and getting this vaccine, and especially our heart failure patients and any other patients that have any other medical conditions that put them at higher risk for having one, either getting the vaccine, or getting the infection, or two, getting a more severe version of the infection because of their pre-existing conditions.
Okay, thank you. Are there any complications or long-term effects from a cardiovascular perspective after recovering from COVID-19? And if so, will they eventually go away, or is that damage permanent?
So this is something we're learning about as we move forward. From what we are seeing, there is recovery in most patients in terms of recovering from the COVID infection. And the hope would be that this myocarditis or these different effects that it might have on the heart would be following in suit. But unfortunately, it's a very controversial question because we really don't have any long-term studies or long-term data to tell us how this plays out because we're living it. So as we learn more, we'll have a better understanding of how this is truly going to affect our patients as a whole and just, health in general over the upcoming years.
Thank you. Could you explain some of the symptoms of heart failure and at what point should someone see a specialist?
Absolutely. So heart failure, like we talked about a little bit earlier, is where the heart is not getting blood out to the body like it's supposed to. So if your heart is not able to get blood out to the body, that fluid starts backing up. So it backs up into your lungs, it backs up to the right side of your heart, and then it backs up into your belly or into your legs. So because of the fluid in the lungs, people can feel out of breath, especially if they lay flatter. Because gravity is helping the fluid actually settle in more of your lung and making you feel more out of breath. When the fluid backs up into your belly, you can get bloating or swelling. And same thing with your legs. You can get swelling in your legs to the point where if you try to press into your leg, you might leave a little indent because that's extra fluid that is now sitting in that tissue. So with all that extra fluid, that fluid is weight. So people will start to gain weight. So we typically tell our heart failure patients to look out for overnight if you gain 2 or 3 pounds, or in a few days if you gain 5 pounds. What I tell my patients is that's not fat, that's fluid, because there's no way you could gain that level of fat in just 1 or 2 days. So those are the things that we look out for, is getting out of breath, doing the activities you were otherwise doing fine. Swelling in the belly or the legs, laying flat is trouble, or if you're trying to sleep at night, you wake up feeling like you can't breathe. These are all things that make us worried that somebody might have heart failure.
Okay. Thank you. And if you do suspect that you may have heart failure, can it be diagnosed through a video visit, or do you have to come into the office?
So I think there's a lot of concern for people trying to get out there and trying to isolate and stay away from potentially people with COVID. But what I would say is, a video visit is better than nothing. But in order to truly evaluate a patient and know for sure what's going on, one would be seeing them in person in my office and evaluating, examining them, looking for that swelling, looking for different other things on their physical exam that would hint me towards whether they could have heart failure. And then what also helps is getting certain tests done, including an echocardiogram, which is an ultrasound of the heart, looking at the heart muscle to see, is it truly squeezing like it's supposed to? Is it truly relaxing like it's supposed to? And those are things that unfortunately we're not able to do over a video visit. So I would say, if you are concerned that this is something that's going on, I think the risk of not being evaluated outweighs, the risk of potentially getting exposed. And I think we'll talk a little bit more about some of the protocols that we're doing at our facility to help keep everybody safe in order to come in and be seen and be evaluated.
Perfect lead into my next question. So what are the risks of waiting to be evaluated for heart failure or have cardiovascular procedures performed? And what do you say to those who may be concerned about coming in to the office or the hospital right now?
Yeah, so I mean, the risk is something that is real, and it is something that we unfortunately have been seeing in our patients. So if somebody has heart failure and starts to accumulate fluid, like we were just talking about, they get to a point where pills alone aren't going to do the trick, and then they end up being admitted into the hospital. And unfortunately, that's what we've been seeing a lot over the past year is people thinking, well, I just don't want to go to the doctor, I don't want to go to the office, I don't want to be around people, and I'll just ride it out at home and see what happens. And unfortunately, that has resulted in people coming into the hospital and being even sicker at that point that they're getting to the hospital, which takes a lot more out of them and a lot more work from our end to try to get them back to feeling better. So that's something that's real and something that should not be toyed around with. People, if you start having any symptoms or any concern, like you're starting to build up fluid or anything like that, you should be calling your doctor. You should be coming in for an appointment. You should be evaluated so that we can kind of adjust medications if need be, even get IV medications done outside the hospital at our Good Health Center, potentially. These are different things we can do to avoid people ending up in the hospital where they would be definitely at a higher risk of being exposed to other people with COVID. In terms of what we're doing, we're being very, very careful and diligent about keeping our environment safe, both for our team and also for all our patients. So all our patients prior to being admitted into our office space are getting screened over the phone to make sure they're not having any symptoms of COVID. And just making sure that everybody is being as safe as possible. In terms of our staff, we're all wearing masks, we're all wearing different equipment, everything's getting cleaned down. This is the safest possible way that you could be seen in order to make sure that you are staying out of the hospital. So we have all these protocols in place, and it is not something that would worry me to even send my grandmother to the clinic to be evaluated. I would say that's the safe way to do it, and that's the way that I would recommend that my family members would do it.
Thank you, Dr. Krishnan. We have a few questions from social media. So thank you very much to our viewers for tuning in, liking us, our video, sharing this broadcast, and sharing your questions. So first question I have is from Janie. Thank you very much, Janie. So she says, considering how COVID-19 affects people with heart conditions, would it be wise to take the vaccine? I think we talked about this a little earlier, but could you reinforce that message?
Yes, short answer, yes. You should absolutely go and get the vaccine if you are, as soon as it's available to you. I know there's a rollout in place and different stages and different levels of when people would be able to get the vaccine. But I even had one of my patients' daughters just the other day reaching out to me saying, how can we get this for my mom? And we're working on it, and we should definitely be encouraging this. And I told her when the time comes, absolutely, she should go get it.
Great. Thank you. And thank you, Janie, for that question. We have another one from Beatrice, who says, what about those with a heart murmur, and does COVID-19 affect them in a unique way?
So, when we study patients with new therapies like this vaccine, we tend to take healthier people and look at that. So it's, when people try to read about that, they're like, well, what about me? I have a heart condition. I have this, I have that. What about how it affects me? And the short answer to this is going back to what we already talked about. This is not a piece of virus that is being put into your body. So there's no risk of getting COVID from the virus or from the vaccine itself, right? So if that's the case, everybody and anybody, especially with a cardiac condition, being at higher risk of getting COVID, should be going and getting this vaccine.
Right. Thank you. We have another question from Sandy. Thank you for your question. They say, how about mitral valve? And for those who don't know what mitral valve is, maybe you want to explain that as well.
Absolutely.
And is the COVID-19 vaccine safe for those with that condition as well?
Yeah, so mitral valve is one of the valves that's in your heart. And so people that have a mitral valve repair or a mitral valve replacement, that would be what she's probably referring to. And that would go along the same lines. It's valvular heart disease, it's any heart disease. You're going to be at higher risk of having COVID, acquiring it, having a more severe version of it. It is safe to take. So you should take the vaccine and try to prevent getting this infection.
Great, thank you. We have a comment that I just wanted to share from Joan. Thank you for posting this. She says, Dr. Krishnan is doing a great job. So kudos to you, Dr. Krishnan, and thanks again for speaking with us today. We have a question from Shelley. Thank you, Shelley, for that question. She says, is there a preference for the Moderna or Pfizer COVID vaccine for heart patients?
That's a good question. So the answer there is really no. Both of these vaccines are mRNA vaccines. Both of them, I mean, there's so much information out there in terms of the efficacy and all sorts of things and the schedule 3 weeks apart or 4 weeks apart and all that. But ultimately, both are safe, both are effective, and both will get the job done. So either vaccine is safe and should be taken.
Great, thank you. We have a question from Jenny. Thank you, Jenny, for that question. She says, AFib and heart failure, are they connected?
Yes. I could probably talk about this all day, but the concise version would be, so AFib or atrial fibrillation is a condition that affects the rhythm of your heart. So the top chambers of the heart, instead of taking their turn to squeeze, so how I explain it to patients is you have the top chambers and the bottom chambers of your heart. The top chambers should squeeze and then kind of conduct through, and then the bottom chambers should take their turn and squeeze. When you have atrial fibrillation, the top chambers are just shaking around. They're fibrillating. So the atria are fibrillating. So if that's the case, the top and the bottom aren't talking to each other like they're supposed to. So the bottom chambers or the ventricles have to work harder. And over time, that can cause them to get weaker, which is heart failure. So with patients with atrial fibrillation, we try to control their atrial fibrillation in a bunch of different ways to try to prevent them from developing heart failure. And if they progress to the point that they do develop heart failure, then we do different things to try to help get them out of heart failure and keep them out of heart failure, and also get them out of atrial fibrillation and potentially keep them out of atrial fibrillation.
Okay, thank you. We have another question more related to pulmonary hypertension. So how does COVID affect patients with pulmonary hypertension? And that question comes from Robbie. Thank you, Robbie, for that question.
So pulmonary hypertension refers to high pressures in the lung arteries. So hypertension, like in your body, hypertension, high blood pressure, and then pulmonary being the lung. So the lung arteries. So what we've seen with anybody with any cardiovascular conditions like pulmonary hypertension, they're at higher risk for acquiring COVID, and then they're at higher risk of having a more serious version. The reason here is a little bit more involved, because not only for the reasons we already talked about, but also because this is also affecting your lungs. So COVID is affecting your lungs, and then your pulmonary hypertension is also a condition in your lungs. So it can really end up with somebody having a tough time breathing, becoming hypoxic, meaning not enough oxygen, and really severely affect their medical condition, end up in the hospital.
Great, thank you. Before we close our discussion, Dr. Krishnan, is there any other information that we should share today? Anything else that you'd like to add?
Yeah, I mean, the take-home message here is COVID is real. We are definitely very much in the middle of this pandemic. And this is not the time to be complacent. We have to be diligent, do all the right things, wear your mask, wash your hands, keep your distance, avoid people that are not in your direct household, get the vaccine. It is safe, it is effective. So these are things that you can do to prevent getting this infection and help, the greater good, the people out there. As we get more people vaccinated, this virus will hopefully settle down, and we can get to a point where we get back to our normal. So these are all things that are extremely important to reiterate. In terms of patients with heart failure and any other cardiac condition, you're at a higher risk of getting this infection and a more severe version of this infection. So you should really be very stringent about following all these recommendations and getting the vaccine when the time comes. And ultimately, it comes right down to it, life does go on. So if you do have heart failure and you are having those symptoms we talked about where it could be getting worse, you should be coming into the hospital to be evaluated, or coming into our office to be evaluated. And we are doing all the right things to make that the most safe experience for you and for our team.
Great. Thank you so much for that final message today. That wraps up our broadcast. Thank you again, Dr. Krishnan, for joining us today. We really appreciate it. And thank you so much to all of our viewers for tuning in and sharing your comments and questions. For more information or to schedule an appointment, please call 410-554-6550 or visit MedStar Health or MedStarHeart.org, MedStarHeart.org /Krishnan. We're also going to share that in the comments below as well. So thank you again, and we will see you next time. Bye.
Bye.